LASIK is a little more invasive in that we're creating this flap in the cornea. It's like a surface layer, as though I was to take away the top layer of the skin of my hand, do some sort of operation on the tendons, and then put the skin back again. It's the same sort of principle. So with LASIK, there's bound to be a greater element of risk because it's more invasive. And this thin layer, this thin flap on the cornea, although it's produced very accurately now with another laser, it's a very highly precise flap in terms of diameter and thickness, but it could come loose, for example. It could get damaged and become dislodged. Or if you were really very unlucky, you could get a bacteria or some sort of pathogen or a microorganism getting trapped beneath the flap, causing an infection, which you can't get with LASIK. Anything on the surface of the cornea would tend to be at extremely low risk of getting an infection. So with LASIK, because it's more invasive, the risks are greater. I mean, we know exactly what percentage the risks are nowadays. The world literature suggests that for an infection to occur, you have to be very unlucky to around the tune of 1 in 3,500. So if 1 in 3,500 patients pick up an infection, then that's obviously a fairly rare percentage, a rare occurrence. And with contact lenses, the usual figure that's quoted for soft lens wear is 1 in 2,000. So you can see that LASIK in that sense is a little safer than contact lenses. I've done over 20,000 treatments and have had one infection in that period of time. So it's obviously a rather sporadic, random thing, and as long as infections are treated properly, there's no reason why the patient wouldn't do well. And my gentleman who picked up an infection, we got onto it very quickly. He came back, of course, for a checkup. We worked out what the microorganism was that was causing the infection, the bacteria, and treated with exactly the right antibiotics, and that gentleman still saw 20/20 vision afterwards.